time is in women. Today is National Wear Red Day, and February is a month of awareness. This is for everyone to take control of their health.
Joining us right now with more is Dr. Stacey Rosen, cardiologist and vice president of the Katz Institute for Women's Health, along with heart patient Maura. Dr. Stacey, Maura, nice to have you on Good Day New York.
Morning. Thanks for having us on Where Is It?
So, Dr. Stacey, let's start with you. You know, a lot of people think that the number one killer for women is breast cancer, but it's actually heart disease. And the symptoms are kind of different in women than they are in men. Help us, understand this.
Yeah, absolutely. So according to the American Heart Association, heart disease kills more women every year than all forms of cancer combined. And that's an important misconception for us to dispel. And the problem is sometimes when women have heart disease, they don't get the typical Hollywood heart attack where they have an elephant sitting on their chest. They're also likely to just have fatigue or shortness of breath, an uncomfortable feeling in their stomach. And women are more likely to ignore these early warning signs.
Interesting. Maura, what happened with you?
So it's about 4 years ago. I was at work and I ran up a few flights of stairs, and I just had a little shortness of breath, and I stopped at the top and I thought, that's interesting. But I was at work and I was running to a meeting and I went about my business and I kind of forgot about it. When I talked to my sister later, she had just come from the cardiologist. We do have a strong history of heart disease. And she said, you have to go to the cardiologist. I said, it was nothing. I'm just really out of shape. I have to exercise more. She convinced me to make an appointment. I went to see Dr. Stacey Rosen. She sent me for a stress test where they found something, and they sent me directly across the hall for an angiogram. And then they took me by ambulance to Northwell University Hospital for open heart surgery.
Wow.
A few blockages, and if I hadn't listened to my sister and hadn't gone to Dr. Rosen and had the stress test, I would have had a major heart attack.
Wow.
Now, Maura, I feel like there's a lot of women that could be watching that are fearful of even just going to the doctors to get a checkup because you're fearful of what people may find. What is your advice to women watching this morning?
Yeah, my advice is pay attention. Due to our busy schedules and the work demands and our caretaker demands, we don't really pay attention and we don't really take care of ourselves. So I would say, number one, pay attention. And number two, be active. Watch your blood pressure, watch your lipid profile, really pay attention to your heart.
Good advice there. Dr. Rosen, the past 2 years, we've seen this massive spike in just anxiety because of the pandemic, because of everything going on politically. And I think a lot of people may be feeling what they think is like a stress pain in their chest. Can you kind of confuse that to something going on heart-wise, or can it lead to something impacting your heart?
No, absolutely. Great question. This has been a challenging 2 years for all of us. And on top of that, it's been harder for women to take care of themselves than ever before. As Maura said, listen to your body, listen to your symptoms, and know that if something's not right, you really should have it checked out. Stress has an absolute impact on heart health, as does lack of sleep, inability to get yourself active, the way we choose our foods every day. And know that some of the symptoms that Maura described, just a little bit of shortness of breath, may be the early signs of significant heart disease. The great news is that we're all empowered to make small changes, listen to our body, make the choices every day to feel better and to have a longer, healthier lifestyle.
I was wondering, Dr. Rosen, if you can give us some of the ideas on how we can make some small changes that would really benefit our heart.
No, thanks, Rosanna. The great thing is that most of heart disease is preventable, and it often, especially to busy women, seems so overwhelming and difficult to do. But it's the small changes, choosing to move more every day, laughing, partnering with girlfriends, families. Look how important Maura's relationship with her sister was. But also getting checked every year, finding a physician or another health professional who you trust, and getting regular checkups.
Yeah, it's very important. Maura, what do you do now to maintain your heart health?
I walk every day. I don't sit for too long. If I'm sitting too long, I get up and I move around. I did retire about a year after, so it allows me to, be more active. But I advise women who are working, get up and move, like at work, walk around the building, walk around outside when you can. Be active.
All right, ladies, are you listening? Okay, because sometimes, Dr. Rosen, as you know, women put others before themselves. They worry about their kids. They worry about their husband. They worry about the dog. And before they worry about themselves. So it's time to take a breath, right?
Absolutely. Put yourself at the top of your to-do list.
Right.
It's not that hard to do. You see how Maura's life changed when she really put a prioritization of her heart health, her checkups, her ability to pick the right choices for every day.
And I really love that you mentioned being able to laugh and have good girlfriends. I'm assuming that this is going to take, add a couple of years on my life because we do a lot of laughing together. So that's one good thing that we can talk about this morning.
And Dr. Rosen, where can people find you?
You can find me. I'm a spokesperson, a volunteer for the American Heart Association. I also oversee all of our women's initiatives at Northwell Health. So take a look at the Katz Institute for Women's Health at Northwell.
Beautiful. And Maura, nice to meet you. Stay healthy.
Yes.
Thanks so much,
Nice
Dr.
to meet you.
Rosen.
Thank you so much.
Maura. Okay.
Thanks so much.
Bye-bye.
All right. So, very important information.
I know. And I feel like we do put ourselves on the bottom of the list sometimes. But 2022, maybe it'll bring about a change.
It's our year.